Well, it's getting to be short season, which means exposed legs. But in some cases, veins are more than just a cosmetic issue. Here from the Vein Institute of Connecticut is Dr. Alex Afshar. Doctor, nice to have you here.
Thank you for having me.
Welcome back. Tell our viewers what vein disease is.
Vein disease is a pathological disease that prevents the blood going all towards the heart, and some blood leaks back down because of incompetent valves within the veins.
And it's not always pretty.
No, it's not. There is a lot of cosmetic issues with vein disease, including varicose veins, spider veins, and sometimes it can lead to swelling and ankle ulcers. Sure. So, you know, your legs take you everywhere, so you need to
take care of them.
Yes.
Talk to me about some of the procedures that you do in the office.
Well, the treatments have to be done from the root of the problem up. So we start with a simple ultrasound to diagnose the disease. Then we close the truncal part of the veins, and then we move off to the branches, which are the varicose veins, reticular veins, and spider veins.
And is there downtime associated with this?
Well, the beauty of it is that these days there is no downtime at all. It's almost something that you can do during a lunch break.
Wow.
So it's changed quite a bit.
And what is the upkeep? Is there maintenance involved?
Not really, as long as when you travel, when you're sitting for long periods of time, when you're standing for long periods of time, the best thing you can do is to wear stockings, but that's easier said than done during hot summer months, right?
That's true.
So there really isn't. What you can do is to get an ultrasound done once a year or so, just to keep an eye on things.
So besides the cosmetic factor, what happens if you don't treat these veins?
Well, eventually there is a chance of a blood clot whenever you have vein disease. There's also a chance of ankle swelling, which continues to get worse. And eventually, when you get much older, there is a high risk of an ankle ulcer, which means you have to go to the wound care center once a week. Okay,
and I understand in your practice you also use Juvederm and Botox for some procedures.
We do that for our own patients, yes. When they ask, we do it. We're quite good with needles, so we get really good results.
That's terrific. And talk to me about your locations around the state.
Well, we have 5 locations now. They are in Newtown, Avon, Shelton, Fairfield, and Westport. And we are continuing to grow within the Connecticut just to make it convenient for the patients so they don't have to travel far.
All right, so it's the varicose veins, there's all different types of veins, right,
yes,
in your leg.
Yes.
Talk to me about the different kinds.
Well, if you have incompetence within your veins, those are incompetent valves that have to be, that section of the vein has to be closed with laser or radio frequency, it doesn't matter which, both thermal energy, and then the varicosities have to be removed. The best results are you can inject varicose veins, but the results are inferior to actually removing them, which can also be done in office, and you're back to your normal activities right off the table.
Fantastic.
And then after that, those varicosities can give branches to spider veins, which are injected.
All right, very good. Well, at least there's lots of options, no downtime, and you're located around the state, so you make it so easy to treat this.
Thank you very much.
All right, and of course you can learn more over at theveininstitutect.com. Dr. Afshar, thanks for being here.
Thank you.